Professor Carrie Mowen, like hundreds of medical researchers, has already fallen off the fiscal cliff. Her budget, which relies on federal grants, is being cut by 10% now as the NIH, the National Institutes of Health, prepares for the possibility of budget cuts later.
This is much bigger than just my lab. It's affecting all academic labs across this country.
Mowen, who studies rheumatoid arthritis at the Scripps Research Institute in California, understands the NIH decision but calls it a setback.
My lab will have to shut down research projects that we know could have profound impacts on curing human disease. We may have to get rid of some staff members.
The NIH tells us because of uncertainty in the budget, awards at 90% of what was promised to researchers will be the standard, at least for now. And the threat of a $2.5 billion cut has raised alarms.
Some of the mice will be a mixture of...
At Johns Hopkins University, Dr. Stephen Desiderio is under pressure to reduce the experiments he designs in mice in his search for a cure for childhood leukemia.
Does that make a more uncertain science?
Not only more uncertain science, we actually lose 10 years.
And the downside of turning off a variety of experiments is what?
We've killed innovation because the most innovative projects are the projects that will go first.
The pending budget cuts have also forced labs to slow down the hiring of promising younger scientists.
Turning them down because I have to say to them, in all honesty, I don't know whether I can take you on that 4 to 5 year commitment.
The NIH hopes to restore the lost 10% if the agency's funding is restored, but this is one danger from the fiscal cliff that isn't waiting for New Year's Day. The reduction in medical experiments and the hold on laboratory jobs is happening now. Wyatt Andrews, CBS News, Washington.